Our program, of course, on Thursday is brought to us by Kaiser Permanente, and we have the pleasure each week of speaking with one of the fine staff members, one of the fine doctors who works with Kaiser here in Orange County. Joining us today, Dr. Everett T. Esteban, and he's in family medicine here in Orange County. Dr. Esteban, welcome to the program.
Thank you. It's great to be here.
Interesting first name, English derivative, I understand.
It means strong as a wild boar.
Okay, well, we won't ask you to do one-arm push-ups to prove that for us this morning, but good to know that's your name. Interesting choice of names there. Your background, how'd you get involved in medicine?
Well, I grew up, immigrated from the Philippines many years ago. Just loved helping people. Was fortunate enough to go to UCLA, going to UCI, Irvine Medical School. Did my residency at Northridge Family Practice, which is a UCLA-affiliated program. And I just love the ability to continue to help people every day.
How'd you get involved with Kaiser?
Looking at the trends in medicine and seeing the stability and also the preventative care aspect of Kaiser, the fact that their motto, the Thrive, all those wonderful issues that Kaiser has, I realized it was really a win-win situation for me and also for our patients, because I felt that I could do the best care for them.
Okay, very good. Well, we're going to talk about something today that a lot of people are concerned about, and that's the subject of weight control.
Yes.
And, you know, we have all kinds of definitions, all kinds of ideas on it. Is there one definition that you doctors like to use for what's normal weight?
There are many different ways you can find out regarding your weight, whether it's healthy or not. In our office visits, we use a term called body mass index. And what that is we look at your height and your weight, and through some type of formula, we're actually able to characterize whether your height and weight is at a normal level.
Okay, so you would measure the person's, take a look at them, put them on a scale and say, too heavy, too light, whatever it might be.
Exactly. There's different numbers. Basically, as a result of body mass index, and you have a picture of that there, we look at a person's height and we look at their weight. A number is generated through a formula. We have a table like this, which actually shows exactly where the number is. Now, depending on what that number is, it tells us whether their weight is normal or is at healthy range for their height and weight.
So we have red on both sides, so it's possible to be too light as well as too heavy.
Exactly.
Right, and then the yellow is kind of the borderline there?
Exactly.
Right.
Basically, for someone like who's 5'5", we look at their height and weight, and the normal range for them, according to the graph as well, is you're looking at around 115 to about 140 pounds because of bone structure.
Right.
And so a normal weight for someone would be a BMI of 18.5 to 24.9.
Okay.
When their BMI gets to 25 to 29.9, they're considered overweight. And that actually shocks a lot of people because it doesn't look like, you know, when we weigh them.
Yeah.
When you come to our office, we measure BMI in every patient. So we're able to consult them whether their weight is normal, it's healthy.
So it's not just a number, a weight number, but it's figured into this table then as part of the
through a formula. Now, when your body mass index gets greater than 30, that's when there's a lot of health issues.
Okay, and I guess that's the definition of obesity?
Obesity is when your body mass index is 30 and above. And there's different classes, class 1, class 2, class 3. Class 1 is 30 to 34.9, 35 to 39.9 is class 2, and greater than 40 is class 3.
All right. So it's something that we need to think about and look at. Some of the medical consequences from being overweight.
There are many medical consequences, unfortunately. In our orientations that we do, I do an exercise with our patients. I actually have them stand up, and I list all these different health diseases.
You have them stand up?
I have them because I want them to be interactive. I want them to burn some calories. And I have all these diseases listed, like diabetes, hypertension, arthritis, cholecystitis, certain types of cancers, and I ask them to sit down if they or anyone that they know has any of these diseases. But usually the third disease, everyone's sitting down. So you see diabetes related to obesity, hypertension, strokes, coronary artery disease, heart attacks. Certain cancers are also related. Unfortunately, smoking, kills about 420,000 people a year.
Right.
Obesity-related deaths are about 400,000 a year.
So it's only second to smoking.
It's very close, and that's why we're trying to be so proactive and try to help people, because we would rather do preventative care for them rather than to try to do second or tertiary care.
Really, that's kind of the whole Kaiser philosophy, and I know that's why a lot of doctors like to practice with Kaiser, because prevention is really high on the list of things you folks promote.
Yes, it is.
Very good indeed. Well, let's talk about how we deal with this problem. And obviously, the notes here tell me that you're an advocate of weight control, and maybe you want to. They said maybe you could share some personal anecdotals on that.
Yes. The interesting thing about when you see someone with obesity, it's different than other diseases. when I see you or I meet you for the first time, I can't tell whether you have diabetes, hypertension, glaucoma, or cataracts. Weight, you can't hide. You see someone, you can tell basically whether they're, you know, a little chubby.
Right,
or,
right.
So basically, this is a struggle that I've had personally. Not to bring my own, you know, struggles in when I meet patients, but when I try to empathize with them, understanding, you know, that this could be, it's a very touchy subject. And it's a very difficult subject.
Right.
Because obesity is very complicated. It's not just weight. There's reasons why a person may be overweight. There's psychosocial issues. There may be depression. There may be underlying abuse in the past. And when I see a patient, if you're a patient coming to me for the first time, I usually do a 40-minute consult, and we talk about all those issues, talking about psychosocial issues. So it's not just putting you on a plan. I have to look at person.
And it's not just numbers on a chart,
It's not just numbers on a chart.
or you know, cholesterol's this and your BP is this. It's the person and the personality and really what's making up their head as well as their body.
Exactly. BMI is, I consider it a vital sign, just like blood pressure, pulse,
Right.
you know, but it's much more complicated than that.
Right.
And that's it for myself. I used to be much heavier. I still have much more weight to lose. But I can understand with patients as we go through this continuum. When I consult patients, I tell them, this is a marathon. You know, this is something that you're going to we're all going to be struggling for the rest of our life. Whether you're at a normal range, you're going to have to struggle with keeping it a normal range, or whether you're at abnormal range and trying to struggle to get to a more healthier range.
Obviously, you know, everyone goes, oh, it's easy to lose weight, just exercise more and eat less. And while that sounds easy, it's maybe more difficult than it sounds.
But you actually hit on a very good, really the key of it all. I put a slide on during our orientation, and I tell this is the secret to weight loss. And I tell them, you signed the paper because no one's ever seen this before. But on the paper, on the slide, it says basically decreasing your caloric intake and increasing your exercise. And people chuckle and laugh because we've all tried to do that.
Right.
The key really is limiting caloric expenditure. In the sense of to decrease the amount that you eat and increase the amount that you burn. What I tell patients, if you were a patient of mine, I tell them, well, let's do a 10% weight goal. If you're 250 pounds, I tell them, let's try to lose 25 pounds this year. Let's use 25 pounds, and I'll give them a plan. And the plan I would tell them is, let's cut out maybe 250 calories in your diet a day. And we could do that one of two ways. We could either take out, you know, 250 calories, so stay away from that soda or for the candy bar, or exercise 250 calories more. If you do that 250 calories of deficit a day, you'll basically put yourself at a 2-pound weight loss a month. 2 times 12 is 24 pounds.
And that sounds reasonable. I think a lot of people want to lose that weight right away. We hear about, you know, celebrities who have a film role and they have to gain weight for the film, and then they lose it within 6 weeks.
Right.
Or someone has a baby and they're ready to do bikini modeling in 6 weeks later, you know. Not realistic for the average person.
Right.
What about things like over-the-counter medications? Diet pills. We see all these things advertised on television, you know, shows these people and they say, I lost 47 pounds in, you know, a short time with this XYZ, whatever it is.
The problem with all these diet aids is they don't really address behavior modification. They don't address behavior modification. I rarely use medications unless I know that patients are in some type of program with me and working with them, because otherwise I'm setting them up for failure. I think a lot of it, as you'd mentioned, is really trying to make patients realize, doing what we call a paradigm shift, understanding that food is really fuel. It's fuel for your body. And the type of foods that you eat are also very important. But unfortunately, you know, and we can talk hours about this, you know, food has become a social gathering. It's become something for comfort. If your daughter's going to go to the dentist, we'll give you ice cream at the end.
At the end, yeah.
Or, you know, if you're going to go to the doctor after the injections, and we've all been guilty of that.
Or it's even part of our religious life, the church social.
Right.
The potluck dinner.
Exactly.
It's certainly a part of a lot of cultures.
Exactly. And, you know, weddings, you know, they hold you hostage till they serve the cake at the end.
Oh, yeah.
You know what I mean? And if the food isn't very good, then the whole wedding wasn't very good.
Right, exactly.
You know, and food has become such a social thing that it's hard. When you go home today, count how many fast food places you're going to pass by.
Oh, yeah. Oh, yeah.
And it's the dollar menus, and all these
Sure.
high caloric, high fat menus are cheap.
Well, obviously, it's a battle that a lot of us face, and we appreciate your open discussion on it. And again, if people want to find out more about Kaiser and the good programs, they can contact them and find out more about it. And you're, of course, dealing with all ages, all types, all shapes and sizes in family practice here in Orange County. Doctor, thank you so much for coming by.
Thank you very much,
Appreciate
Rob.
the program today. Dr. Esteban, our guest today from Kaiser Permanente. Again, lots of good information and lots of good subject matter there for you to think about and discuss as well. We'll be coming back with more right after this.